Morning, folks. Today this will be the first in a series on, health, wealth, and freedom. We're going to call it Americans Prepare to Lose Their Health, Wealth, and Freedom. It's from McIlvaney Intelligence Advisor. We've known for some time that America was on a very slippery slope away from freedom and towards tyranny. In March 2010, that slope just got a lot steeper. That's when Barack Obama signed into law a massive overhaul of America's healthcare system. While the new law does not provide a public option, which would ensure a complete government takeover of the system, it does take a giant step in that direction. Mr. Obama, upon signing the bill into law, declared that the overhaul takes a huge step towards universal coverage. You've probably heard a lot of horror stories about what this new law will mean to health coverage in the U.S. What you're about to see, however, is that it's much, much worse than anyone is telling you. In 2,700 plus pages, the new law will strip you of your health, your wealth, and your freedom faster than any previous government maneuver. Not only are you about to lose your access to the best health care in the world, but you're also about to see our country become a total police state, with armed agents swarming hospitals and breaking down the doors of your favorite clinic. You're also going to see massive bankruptcies around the country. One by one, states will declare bankruptcy, handing over any remaining states' rights to the federal government. Major corporations will fall to their knees as the new law increases their spending on health care coverage for their employees. Major government takeovers, like we saw with GM and the banks, will be commonplace. Our government will soon own more businesses than any other entity in the world, and the ones it doesn't own, it will completely control. We'll be living with a particularly American mix of pragmatic and authoritarian economic systems. The word socialism is thrown around a lot lately. While an economic system based on government ownership of business is definitely growing and playing a huge role in our new system, what we're headed for is far worse. American government officials don't hold to one ideological system. They're far too pragmatic and greedy for that. They use whatever system plays to their strengths and gives them the best leverage for increasing power. When socialism works, they use it. But we'll also face a revitalization of fascism, government control and cooperation with, but not ownership of, businesses. The new health care bill fits this description. However, the new bill does more than control businesses. It controls state governments, and it controls individuals in ways this country has never seen. It sets the stage for economic destruction and coordinated moves towards international health care standards. Loss of freedom in health care and across the board. Perhaps the biggest concern most Americans have regarding the new health care law regards their ability to access medical care. We've all heard the stories from Canada, where the average doctor spends about 3 minutes with a patient before writing a prescription. While it's not much better here, in Canada, it's a numbers game. They have to turn over scores of patients each day just to make ends meet because of the low government reimbursements. Doctors know the government doesn't pay much. It also takes months to get necessary surgeries. If you need knee surgery, it could take 10 months to 2 years. Any doctor who does your surgery outside of the system will lose his license, sustain a huge fine, and potentially go to jail. And you could see fines or prison time too, as it's a crime to contract privately and use your own funds for medical care. That's why thousands of Canadians cross the border every year and pay for medical care out of their own pockets. The surgery is done quickly and skillfully. While the U.S. doesn't have the same free medical system Canada does, even with this new law, every intervention step the government takes brings us one step closer to this type of system and this type of inefficiency. Amazingly, the Canadian government fears the U.S. moving to this type of public health system As more Canadians stop coming across the border for their medical care, Canada's government will have to pay for all those surgeries it now avoids. As you'll see shortly, this policy of implementing universal medical coverage under government control will cause massive financial troubles. But it's not just the U.S. that will feel the devastation. It will also impact all of North America and the rest of the globe. Our other North American neighbor, Mexico, will have more freedoms in this area than we do. We already see many medical clinics moving south of the border so they can operate with limited government intervention. Soon, Americans will act like Canadians and go south of the border for their medical care. The future is now. Even though the U.S. still has insurance companies paying for coverage, our access is still set to dwindle. Doctors are already overwhelmed by bureaucracy, red tape, and regulation. With the new law, a survey from the Medicus firm, physician recruiting firm, says 46.3% of primary care physicians, family medicine and internal medicine, feel that the passing of health reform will either force them out of medicine or make them want to leave medicine. Losing nearly half of our physicians will substantially reduce the supply of quality medical treatment. We've already seen an uptick in the number of doctors retiring early. Add this to a drop in the number of students who will become doctors. Money is a major motivator for upcoming medical students. The same Medicus survey says 41% of physicians feel that income and practice revenue will decline or worsen dramatically with the new law, especially if we see a public option down the road. The survey, which was done prior to the new law, also said 36% of physicians would not recommend medicine as a career regardless of health reform. And another 27% would recommend medicine as a career, but not if health reform passes. Over half the doctors currently in practice would not recommend their profession to upcoming students. Combine lower incomes with little encouragement, and we'll see the number of doctors fall dramatically in the years to come. In essence, you're already losing your access to the healthcare you've enjoyed your entire life, even before the government implements a single-payer system. I'll continue with this on the next video.